And also, because when it's diagnosed late or if we detect it late, the treatment becomes more difficult for the patient. Not only that, but it's costly. Not only to the patient, but to the NHS. So how do we try to detect serious diseases early so that the treatment is effective or curable? That is where screening comes in. And that's what we call checking. And there are different types of screening. So if you're a lady, you have heard about breast screening, you have heard about bowel cancer screening, about the prostate screening. There are so many of them. But today, what I want to talk about is the bowel cancer screening. So bowel cancer, as you said, is very, very common. And the screening in bowel cancer is to check for bowel cancer or early bowel cancer in people who are healthy. So screening is not for people who are ill. Screening is for people who are healthy. So if you are healthy, you won't have any signs. So again, as I say, it makes the disease curable. If you find problems in your screening, it will help us to follow you to prevent it happening again. And sometimes our families become aware that there is this sort of problem in our family, and your family can also, change their lifestyle. So if we talk about bowel cancer is a very serious disease. I work in that unit. And how many of us are in this room? Maybe 12. By the time you are 20, one person will get bowel cancer. Touch wood, hopefully that doesn't happen. But the statistics show that one person will have bowel cancer in 20 in their lifetime. And as you get older, the chances of getting any disease and therefore bowel cancer increases. And now there is evidence that bowel cancer is even occurring in the younger age group. So we call it early onset bowel cancer. And also the immigrant population. How many minutes now? 5 minutes. The immigrant population. So the evidence is that because we've adopted the lifestyles of this country, the diseases that affect these people, as we also get older, we also pick up those diseases. So we've got to be aware of this. So bowel cancer, as we say, it starts as a small lump in your bowel and it grows into a bigger cancer. So the screening is to try to detect cancer at this very early stage. So when you're 50, when you're 60, you have a pack like this in the post for you. And they will give you instructions about what to do. It's a very simple test. You just do it and send it back to them. And they will let you know what else to do. So 60 to 70 years, I know we are not there yet, but if there's somebody in your house, besides a call, why your bowel cancer screening? If it comes in the post, don't throw it in the bin. So please, it's very simple. And you do it every 2 years. It's easy to do. It is, yes.
Does it come automatically?
Yes. Yeah, once you are 60 years, it will come automatically. And also,
I'm sorry to interrupt, but sometimes if you've changed your address at your GP surgery, you won't get the thing posted to you. And to say, what's the address of GP surgery? Now, where is 60? Contact your GP. And it's very important.
And also, you shouldn't wait until you're 60 if there is a family history if you have a family history of bowel cancer or things like that. Speak to your doctor. They may do this test for you. And it's not all the tests that is positive. means that you have cancer. The test for blood, which can come from anything, including cancer. So if it's positive, it doesn't necessarily mean that you have bowel cancer. We do believe that only 54% of people who are sent this kit do the test. 54%. So half of the people don't do it. So why do people not participate in bowel cancer screening or other programs? This is very important. People believe that they are healthy. There is nothing wrong with them. And it's true. When we are going about, sometimes we feel healthy, nothing, By the time you have bowel cancer symptoms, one, there is a change in your bowels. I'm just saying. So maybe I'll go toilet. Now we say diarrhea and now the regular one has become sometimes constipation. And now you feel a lump in your body. By the time you're having symptoms, sometimes it's a bit late. So if you are healthy, yes, this is the time for you to have bowel cancer screening if you are at that age group. And people say there is no family history. You hear a lot of African people say any emotion. It's true, but that's what we want to check. Yes? Sometimes we are afraid. I myself, sometimes we are afraid. Say, hey, we get test now. Now it comes positive. What will I do? But remember, the earlier, the better. Okay. And sometimes also we are embarrassed because some cultures they don't want to test that. Some people say they don't have time, lack of time. But please, the test is so simple. People say the procedure is complicated, but tell me your life and going the other way. Which one is please, is People also think that it is better not to know. And a lot of people say that, well, if I have it, I have it. But it's curable if it is detected early. So why don't you want to know? Yes. So in conclusion, I think we are blessed to be in a country like this, where everything is, your health is almost free. All you have to do is stick something in your food, put it in, and give it to somebody to do whatever they want to do. Yes. As I always, I was joking with my friend. I said, we are in the promised land. If you get your milk from Lidl, you get your honey from Costco, the land flowing with milk and honey, free health. What else do you want? Okay. So bowel cancer screening has been very beneficial in most countries, and it has cut down on people dying from bowel cancer. So with the diaspora community, I came here in my 20s. Now I don't want to tell you my age, but as we all get older, we are getting into this disease range. So please, I hope that this has enlightened you on the awareness for bowel cancer. Thank you very much.
Madam Chairlady, thank you very much for inviting me as well. I'm my friend John Cote, and my age, my NHS, about 30 years, and 12 years as a hospital doctor and 19 years as a GP. What I've noticed is a young Ghanaian community, your interaction with GPs, and papa. A lot of the time, you see GP services in the year, and now you call GP once one. Antipato, now we come This is very true because you have more appointment, but you jaimu. Obroni no jaimu. When you say BB, you know so many. I say for manager, the man is in Casa. But you have reception, so say appointment you go pay. Now you are too laid back. And you can't say for to call. But wouldn't you?
Oko doctor say paracetamol should be there.
And also can you be person discuss it. Say woko doctor no ho na say we read kakra about the condition. No catch us a paracetamol. We say no, would you Dr. Mpacho, we share you know NHS choices and yes I know what say the paracetamol by way. Timpacho, Gamikai, and I just say you may yano, a bit near this or that. I want you to rule those out. Who be so respectfully, obey your mom. But yet, they are not telling you can be an sorry. I just want to talk about how GP services work and how we can make the best of it as a GP. Right. GP services, and yet GP surgery, you have primary care services. Primary care services, and yet they are GP, but you have occupational health, district nursing, podiatry, eye services, mental health. It is just to prevent us from being ill. Until the now you're here and prepare services. And it's all about prevention. And the first thing I want to talk about is GP registration. Who can register with GP? Yemina, your GPs. A bit more console, Yama Upper University. Into your sister, you work for GP surgery home. Or Buffy Nasa or here BBA. Who can you say register what happened to call? And that shouldn't happen. It shouldn't happen until your friend be temporary registration. Into Mubano University Abana, only with surgery hobby, you know. Catches Aqualan were holidays into the TR4. Who can research is known himself, you know what you're talking about. On Casako. I walk out in the Mubano University Abana, young and why I should patch Dr. Keno, only have co-working center. No, who got now 4 hours. If we should all know about the types of registration at GP services: permanent registration, temporary registration, and immediate necessary registration. Immediate necessary is a woman near Besra of Ghana, only NHS card. Fine, but so you are in an emergency by WHO rules, you know, I say GP mission. Into what can the GP say? May show woman that is a no, work immediate necessary registration. Into all these types of registrations are there. You move be aware. Into what kind of reception say, we'll register with her. May I say, okay, yeah, no. Into we have homework about all these things now. We'll call GP with a bit of information. Now, all the information I'm going to share with you is on NHS choices. NHS choices. We'll call website now. The BRO. Everything I'm going to say is there. Okay. Now, what registering a web booking appointment, you know, now say when you say everything is done online, you need to put enough information there for you to be taken seriously. Into language that you use with GP services, and also if you are and you generalize it to do. People say, I've got general bodily pains. They don't take that seriously. Until we should be a bit more specific. So we'll show that we are, because show that we are. It started 3 months ago. I get worse. My mom is such a year. Just be a bit more clear. No one found seriously. Obviously, what people say, me hire me ya. Me how captain was say, yeah, no, one thing at a time. No one can just say no. It's all related. Please, it's all related. Let me finish my. Yes, but it started with maybe a bit of fever. Then I had a headache, and I've got joint pains. But what I say general bodily pains now, immediately, you better paracetamol, it's a fat napo. Until we should be a bit more specific. So, wakuma na elbow faster, palpitations. There are a few words I'm saying you need to retrieve, but we need to get these words here. So, I need to meet IUC GP services in India. Now, with your online form, then we are practice nurse, and now physiotherapist. And now say paramedic, and now physician's assistant. They are well trained. And don't reject those appointments. But we put the said your it didn't add up to what your expectations are. No catches open your own book in a doctor. Now Dr. Nakasa. So the consultation doesn't end the first time you go there. If you've been asked to see paramedic and now say practice nurse, not your kind one TSA. Now what's your okay, who is doctor? You're not insisting, you're just being polite. They will allow you to see the GP. Okay.
Is it there and then?
say GP say emergency, they have to see you there and then. And your agent so but so what they call it very serious. There's always a duty doctor who is supposed to see patients if the initial consultation hasn't gone well. But that's it. Right. Now, online registration, information in our website and also, but more here the GP website or GP website. Good. Info education, how to book appointments, and lots of talks about health. Now, I did say that there are other things in primary care like occupational therapy. Occupational therapy, no, I don't need the end. To say, maintain for stairs with you, into before they make a stair rail, I'm also with the apple. The miska with the rail now. Who can give you on referral? They will refer you to the occupational therapist and they will help. Ebimu yani ma mo nete ebia ni waist ya the low back pain ni head ontini full bath tap no wo frɛ wo ko hu GP na occupational therapy on be referral na omo abehwe then whatever adjustments need to be made in the house no that will be done for you. Okay, district nurses almost ba fie to say okay your operation, but the operation is such that you need a dressing change but you're not well enough to go to the surgery. You can ask them. Say you want the district nurses to come home and help you. So all these services are there, but we're not aware of them till we don't utilize them. Mehu Ghanaian patients or nini maami say maami untimi nante uni wheelchair no more dragging you to the surgery. You can ask for a home visit. Because maami yarino untimi move, the GP would have to come and visit or send somebody to come and visit you. So all these services are there. Okay. But you questions for one.
Can I just ask the question? With you saying so we have to call the GP and ask for help. At times when you call the GP, they will tell you all the doctors are busy. But let somebody call you and you don't hear from them. The next day you call again, they say, oh, he didn't call in time, he's fully booked. And you just carry on. I'm having that problem. That is why I'm saying it. And it keeps going on, and you get frustrated. And at times you have to go there and just pour out your heart before somebody listens.
Yeah. And you know, we all have to be aware of complaint procedures at every general practice. Yeah, GP before you get complaints. Because when you are in CQC, they come and visit. Or when complaints in Bibria, we get marked down. Nobody wants to be marked down as a bad doctor. And you know, who complaint practice manager and say, this is the problem you're having, or best of all. Into hospitals who are more pals. I don't know if anybody knows about pals. Also know, say, Bibina will need to work tremor pals, they will address it for you. Until say, until work on that several times, you're being fucked over. Write a letter to the practice manager. Like I can say, you're raising this complaint and you want it sorted. Because a lot of the time, like you said, no, also my friend, they didn't call, but they should call really. But because we don't complain, no, they get away with it. And the practice manager is there to address all these issues. Just write an email to the practice manager. And then we will say, what are your complaints? How do I complain? I don't think I'm getting the service that I'm entitled to. And then they would help you.
Can I also add, if you call your GP surgery and then you tell them what your complaint, you say, who am I speaking to? You take a name.
Would you do that?
You take a name. And then at the end of the consultation, you say, so you mean you're going to call me back in an hour's time? Yeah. The GP is going to call me. What about if I don't hear? So they know that people really are not bothered. But these are the steps that you have to take. You have to let them know that this call is not just going to bounce and sit somewhere. You've got to know what is going to be done. And if I don't, you can even ask for a direct number. And I think that is the problem. There's so many patients that the secretaries are under so much stress that they just want to let you know that, look, we don't care. But you've got to stand and again, as I say, make a complaint. Once you make a complaint, this country, they don't like complaints.
No, it's not being rude. It's about saying that what they've done, one thing. Uncle Patrick.
Because I'm saying, some of them campaigns is what Chirima Matthias.
Okay.
Because I'm saying, for reception for they don't care about what we are talking about. It's in a way or obey ignore. And that's what Baron sound was okay, me from back, they ignore. I'm saying, son, I'm saying, Papa.
Into me say, my friend, me said, you see a friend John Corty, Mpacho, one of the name say. Yeah. My name is John Corty. May I speak to so and so? Or she would know why it is over from back. Who did I speak to? No, I wanted the actual. No, the actual. Do you complain now? Yes, I spoke to a receptionist. I spoke to this particular person. Okay, I say a friend. Still, I'm in
Can I just add another one? And also it depends on the complaint that you have. So if, for example, you say you have generalized bodily ache for 1 week or 2 weeks, it's not an emergency like somebody who got severe headache in the last 24 hours. So be careful about, your complaint. Your complaint must warrant being seen very early. That's why in our clinic, somebody when you was who moja ka crazy, but the doctor said moja so you have to see them within a specific time. I'm not saying you should lie, but your symptoms have to warrant being seen early. So you have to be very careful that when you're calling, you've got the right complaint.
Yes, Linda.
You use the whole concern this particularly. I would say there are other services attached to the GP basis. Most of the already start. On my own now, where say we want to sell one casa who best like
that is true.
My mechanisms all these things are will come. Or I mean, who are you to hospital? Me, me, a catcher will say, oh, wait, occupational therapist, best friend, and I say, community nurse, a back. And some ones, oh, we can make access. But them I mean you or my bad how would they know so no in said GP and it was all and then Dr. Bocas, I want to make us my win brave feet and we frame it. See how do we
meaning our website and also into your GP said their website, all the information and all the services are listed with contact numbers. Into if you go on the GP website, you can raise it with your practice manager. Because we're supposed to publish all of these, by the NHS contract, the Amman GP for now. And say publishing services what is available. Mpamcho, you want him to work NHS app. Thank you. And when say more upgrade, you can see all your records if you want. You just have to sign and ask the GP for full access to your medical records. From April 2022, there will GP or app and so if you want, you can download everything. A lot of them, so I say with me, order will repeat prescription through the app. You don't have to go to the surgery or call them. Because most friends now person we repeat the prescription, they don't want to take the prescription by telephone. Because one thing you know more wrong one, a bigger problem. Well, that I see where the receptionists are coming from. Although old people don't need a computer or the website, it's a problem for them. But a woman maybe anything in your app and manner, you can order all your prescriptions just online. Now NHS app with facilities being brave also. And please don't forget to load your NHS app. It's different from the COVID app.
Oh, I did something on my doctor. I think with he said ordering the mob stick, real store. You can do self-referral to Millbrook.
Thank you.
You don't have to go through your GP referral.
Okay.
And then you do your own self-referral if you need things like that.
Thank you. The other services on work for continence services. Because as we get older, the bladder becomes weaker, and a lot of our mothers, if they are staying with us, need incontinence pads. They're very expensive to buy, but it's free on the NHS for everybody over 60. And so when you need to know you have pads to keep them drier, you can contact the GP surgery or the district nurses on by referral for the continence assessment. That the best supply parts in all of the NHS. Yeah. And a podiatry also for old people who couldn't do their nails and all that. First, now you're free. Now say you pay a subsidy, but that service is also there. And you can either access it through your GP surgery or direct referral if you wish. Any questions so far? I mean, person will come back as something in a hunting.
ask you a question? How about negligence?
Negligence, good question. If you feel sad, there will doctor here, you know, the outcome has been bad. So we're missing with diagnosis. For example, you went with change in bowel habit. Say the stools are here loose. One year tested now, and you know, later, 5 years later, when you say almost when you're bowel cancer, but you went to your GP 2 years ago with this same symptoms, why was it not investigated? You have to raise the matter. Into one raise, now you write to the practice manager again. They would have to get a GP to account for why they didn't do the test they have to do. It's not just for money and compensation, but also for good practice, for the doctor to learn about a mistake so it doesn't happen to another person. It's not all about negligence, it's not all about just money for you or compensation for you, but it's about, yes. Yeah. Yes, Auntie.
One thing I'm just saying is, first, you know, if you register with a GP, you get your own allocated GP where you build that therapeutic relationship with. But what realized said, since I've moved house and joined another GP, you know, I've not physically seen the GP that I've been assigned to. It's always somebody different. But I thought said you have to build that relationship. So every now and then you want to see a GP, you see somebody different. But then if you get letters from hospital, you got to kind of do go for some few tests and they've kind of allocated you to this GP. And if you fill in a form, I also throw that GP name, but then you don't have any relationship with this person, which is quite confusing because if you just move to it.
You've got a good point there. In the good old times, every GP had a number of patients registered with them. But now so more you're short of GPs. And the brains who you're part-time. Until the patient belongs to the practice in most surgeries rather than the particular GP. But what a lot of people do is for the same condition, ask to see the same person. Because unless I will come and and also I will know to say yes, but it's not the same.
But what if you've moved, now they've assigned, but then about 3-4 years you've not really seen that GP before?
You can ask to see them. Which, like I said, person who registered GP, they may say, okay, because you want to see a particular GP, you may have to wait for 3 weeks or 4 weeks. Fair enough. Until whatever it is, if it's not urgent, you don't have to be seen today or tomorrow. With the person who will register GP, Dr. Cote or Dr. Audrey, no problem. Until they might say you have to wait 4 weeks to see this particular doctor. That's fine. Yeah.
And when you register, you have the option of telling them which doctor you want to see.
Yeah. But for the same condition, it's best to see the same person. Now, before I talk about hypertension, I don't want to take too much of your time. Evening, the weekend service in Soho. And some of us work until 9 to 5, you don't have the time to get time off work to go and see a GP. Into condition, air condition everything at train, catch us a work evening services or not urgent care. Urgent care they are different. The government has commissioned all of us GP to do extended hours. The extended hours here from 6:30 in the evening till 8:30. Now weekends also, I think it's Saturday 9 till 4 and Sunday 9 till 1. But the only problem with that is you won't see your own GP. Because not all the GPs want to do this weekend work. And the doctors on one contract if your condition doesn't have to be with your own GP and you don't have time to take time off work, ask them to be booked into the extended hours clinic on the Bukama. So that facility is there.
Based on that, does it have to be your GP surgery? And I said, when you get that service, the reason I'm asking is, within Milton Keynes, is it all GP services are meant to do that?
They're all meant to do that, but not everybody does it on their premises. And there are about 5 practices or one contract is on their extended hours. But you have to go through your GP to book it. Into you may go to Parkside if you're in Bletchley area, or you may go to Wolverton if you're in Southern area, or there are 4 practices or 1 year late service. Yes, so that facility is available. Right. Now, quickly before I finish my general points. Now, there are a few things to say in Ghanaian language. I mean, who brought for what's in the machine? The machine, the machine. So I don't know whether it's a panic attack or I feel anxious. But apropos of what they say is I have a feeling of impending gloom. I say they use that a lot. And I think the equivalent is the machine. And often when you have a condition, check a cry and it's getting worse now, you do baby and you get that feeling of yes. And to say convey that to the GP because I just get this feeling of impending gloom. And I say something bad is going to happen. You can say that, but the machine in the Miami direct translation. If you feel like a translation. Now, one thing I forgot to mention is the optician services in primary care. Opticians, from under the age of 17, and then from the age of 60, you're entitled to one eye test free on the NHS. Until you'll be already 60 and under 17, an eye test, they have to book with the optician in advance, but it's totally free. If you've got a condition called glaucoma, where the pressure in the eye is going up a bit now, and so you're entitled to yearly eye test, it's free, and you don't go and pay for those. Local NHS choices now, they've listed all the conditions. I will be a free eye test. No, we say even at the age of 40, if you have a sibling or a first degree relative or glaucoma, you're entitled to yearly eye test for free. Yeah. Now, so what way that? Now, so we claim the money you paid to the optician, you can claim it back from the NHS by filling a form. It's all on the NHS website. Good. Now, quickly, we talk about prevention. Prevention is better than cure, and the earlier the better. Into GP services, so you will not just a screening test, there were health checks. The health checks, we're supposed to be invited from the age of 40, at least once every 5 years. But GP now, when you're busy, there are 12,000 patients on flow. They go through the list, but it's so slow. While we will check it, you can contact them to say, I haven't had my health checked. I'm 40 now. I've been to the NHS Choices website. I'm supposed to have a health check once every so appointment, and they'll do it for you. And the health check is very important. It is aimed at preventing heart disease. Health checks is aimed at preventing heart disease, strokes, hypertension, diabetes, in particular, those four. Because they're simple. Cholesterol check, sugar levels, lose weight, and then do this dietary advice. And it helps. Until be only and they already 40, they can contact your GP. They may not book it immediately, even if it's in 6 months, 3 months' time, at least you've got that booked. Most of the time, if it's all normal, you don't have a chronic condition every 5 years. But just hypertension, diabetes, they're one throw anyway, and it's supposed to be every year.
So whereby you have issues when you go,
no, the receptionists are wrong. Waiting. It's on the NHS website. On no grading and also air appointments. Until they are other camera within next person and then all come. Until the whole say I've gone on the NHS website. This is it. What's the inquiry? Just write in an email. Now say what their communication with electronics now you're better with GP surgeries. Into travel and what is in black and white in your notes, they can't erase it. Into 1 year, maybe a year later, you can tell them you asked for the help and you didn't get it. Please don't get fobbed off at all. You're too gentle. I know we're kind.
But I'm the reception for I'm so having a cacao because off Roma. Maybe beside, or catch us a what for. It's a what for nothing. I did not know what to say. And I'm so I just want to check. I said, yeah, but what for?
No, what I can say, Lady 40, NHS website say I'm entitled to a health check.
Massa me move there to me the host name call.
What you say there is that I don't know whether I have hypertension I don't know whether I have diabetes. So that is why you're going. Because you haven't told her what for. You must remember that these people are not medically trained. So you must give a reason.
It's got nothing to do with whatever I say. I just want to find out about the doctors. How about some of them to have got some hygiene problem? Can you also complain about that?
Of course. And maybe
What hygiene problem?
He said, Doctor, maybe I'm what you want.
That is very rare. Very rare.
Anyway, now, so.
Pamucho, this medical credit so the doctors the train. And said baby I free. Service we are crying doctor show now. Won't be Mr. Doctor, they said you know who ye. And one is our church rama say, Ukoye labo, Fedro we a dear and no womb, ya rebel and their help. Young country, and I'll be Sir Doctor and so cry or full so challenging. And say, am I a movie brain or hey, I we near maybe or what? And what you're right to say was say would be sir. But Sadia na share 3 be a friend, ye Mr. Doctor 17. I'm not dear Doctor Becca or her dear and just you.
That should change. And you can even ask for your blood test results. So we should know what ratio, like you didn't work on your blood test, or something normal. Had you normal, and him normal. Because can I have a printout of the results, please? No printout, ma'am. Who could fear no one washing, meaning a normal range in a wall, no washing. You won't ask you can circulate and ask them back when you go. Or if you've got a friend that you can ask, that's absolutely fine. Right.
And one thing I tell patients is that when you're going to have a lot of follow-up, so you're going to see a doctor, you're going to have tests, you're going to have results, you're going to have follow-up. The best thing to do is what? Get a notebook. Because some people have been coming for follow-up for years. They don't have anything about what the doctor is going to do. So when you leave that place, some people even write it there. That, oh, so doctor, you say I'm going to have a colonoscopy and you're going to book an appointment for me in 6 weeks' time. So you know what is going to happen.
Let's prepare across and all the information is there. Asthma UK website, diabetes, hypertension. There's so many websites that you can get information from. Even all those are not necessary. Just go on NHS Choices, type in the condition. If you type abdominal pain or make sure what could be wrong, you have an idea. Don't get too worried if they say this and that and that. It's not all relating to you. But if you get a bit of info, don't go to GP now. You can express a will in their work and they can't form you off. Who can way prepare that? But who can tell with a blank sheet and everything they say is yes doctor, and yejuma. Now, a family history is one thing that as Ghanaians you don't see. Every time we show Bronibia notes as a GP, we actually family history of heart disease and hypertension, diabetes, asthma. You have Ghanaians notes over their family history are blank. Because you have family history as them. First of all, culturally, you are paying for the bigger one country. Secondly, diagnosis is a new woman, the bigger will figure out with doctor and say, then I hear the man home country. Until we're lacking in that department. Until Pamucho, we are all family like black clots or family. And because there are tests that the GPs can do if you have a family history of blood clots, for example. And you have a condition, cardiomyopathy, where the heart gets enlarged. And you say, no, it's passed on from generation to generation. It's not so catch your GP now by 40, on your heart scan, all those things, sickle cell disease. And you see now, who catch your GP, there are tests that they need to do. No, be our sickle cell, not relative or sickle cell. Now, so your lung function and the heart scans, that should happen every year. I can't emphasize that enough. But GP will mean it has to be a specialist sickle cell clinic. Almost won't register, they won't even call you. You have to insist. Sickle cell is quite common among our black communities. Until scans of the heart, lung function has to be done regularly. Right. Now the topic I do I'm saying and we start here today. We're going to talk about hypertension. Hypertension also, it's very common in us West Africans in particular. 1 in 20 of the population in the UK will be diagnosed with high blood pressure. Now, here West Africa, particularly young kidneys, are very susceptible to hypertension. In Timobeti, I'm sure you've heard all the relatives almost struggle with kidney problems. Because first of all, your maya druna young fat, blood pressure druna, your maya, or be the prescribed druna, we money bioma for 1 year, or the banana 200 over 130. And then so top one, I say you're 130, I said you're 70, 80. Not top 1 year 200. Listen, but last time we drew, one baby bill, doctor, we train man 1 month, we find a sign, not my fine to my body. High blood now, who first saw Beccasu, a drone of Beccasu. It's not a dependent drug. You can stop anytime you want to stop. But so if it's a big blood pressure monitor, you don't need an expensive one. You don't need one that costs £80. It will track this and monitor this and do a graph. No, straightforward BP monitor, £30. It is a who officer will want to them person doing far. Fair enough, but check the BP at least once every fortnight, once every 2 weeks. We check now numbers no was right. Go back to your GP. It's only 1 in 50 hypertensives normally cured. Okay, the vast majority of hypertension with a kawa, you can't reverse it. You can lose the weight, you can cut out salt, you can make lifestyle changes, my levels in our phone, but often it creeps back. Into carry on checking. Into wood checking as a BP and normal all the time, no way that's fair enough. But you can't just say the team never ya, the national agreement and they call it no. Because the only time you get symptoms with hypertension is when it's becoming complicated. Now, a year complicated, it affects the heart, the brain, and the kidneys. Those are the 3 areas that hypertension are affected. Into blood pressure, and when you have black people, you move chain our phone. But our fade rocha by far. Until they tend to suffer. I don't into high blood pressure. 1 in 20 of us would have hypertension, and most of the time we don't know the cause of it at all. But when you have high blood pressure, they check your kidney, they will check your thyroid, they will check your hypertension. For example, they do more conditions of steroids. Steroids is a blood pressure and sugar and so forth. So the GP will look at all those things. The common one I want to talk about is ibuprofen, any cough medicines. They contain chemicals, so we find regularly. I'm not saying don't take cough medicines at all, but if you are every month again, every month again, continuous use, and might be ibuprofen, any your friendly insects, ibuprofen, anti-inflammatory, any naproxen, will find the brain, so it never be and it's not very good for the kidney either. And you will hypertension, be careful with those anti-inflammatory drugs. And monitoring, and also making sure that you have a monitor to check so we don't suffer any complications.
Actually, this question. This is really challenge your GP, knowing very well that it will be Number sign prescribe it, naproxen now.
Yes, you can ask them. So I don't know high blood sugar naproxen, but it's not wrong to take it for short term. Until you when you severe back pain, paracetamol in the codeine in the we hear anti-inflammatory. To take it for 2 weeks or 1 month is not harmful. But so who blood pressure, now who condition number 5, naproxen for 2-3 years, then they said no. You can ask them. But short term use you're fine. In case of blood pressure, men find ibuprofen. We at a short period of time, but not continuously.
And just to chip in, you're not going to challenge this. You're just going to say, oh, doctor, is it right with my hypertension to take, and then he would explain to you that yes, it affects your blood pressure, but you're just taking it for this, and he might even educate you more, on his plan of management.
And just to finish off on hypertension. Oh, sorry, question. Sorry.
It's just an experience I had with my GP. They were giving me naproxen for a while. I started having that pain, the chest pain. I kept going back. They didn't do anything about it. They prescribed a new one, another one. So one day I felt the pain was just too much, so I went to walking center. Luckily, I met a doctor that I know, and he went through my notes and then asked questions, and he realized, oh, actually, this is what is causing this pain. So he asked me to stop taking it, and then he prescribed something else for me. And ever since, the pain stopped, and that even made me not trust my GP anymore.
I get your point. Entirely. Right, into your questions. I've got 4 minutes for questions.
Dr. Mpacho, Miss Media, Obiam Sharona, I assay, yet the net to hay fever tablets. But for more than 2 years, not just a repeat prescription. Hay fever and suminim say season. Now, a no sign. Me would be raising yet a contact GP no more almost 3 years. But I said, Nipa be brave or in Roya don't to swap. And no one say repeating, no ye repeat this. Ye frail crown, ye check it so. It be a drone now, won't say, a cost right now will fall. I was see it 2 more and I said, was see it. A whole soon patch of it.
I know the idea before the Tipa because it went close, until you won't. For example, you said we've got 12,500 patients, and I'm sure about 4,000 they will repeat medications. Into review, every year, you get my contact with GP said you want a medication review. They can either do it on the telephone or do it face to face. No matter show. Do you still need this medicine? Can this be changed? Because is the dose working? If it's not working now, I'm going to increase it or decrease the dose. Until I say every GP, every year, a medication review, but until me, until I employ pharmacists, I also go through the notes to check on medication review. City, we're getting there, but it's far short of what is expected. No more chronic diseases in the friend every year. It's asthmatics, hypertensives, heart disease, diabetics. Diabetics get the best care in the whole of the UK because they get called every year, mandatory. No one you like where would you fall out of these 4? I'm afraid you have to take the lead. Apologies.
And then also some surgeries, you can only self request every so often. So it's not going to be automatic. Every 3 months. There's a story about a lady who had a room of medication because every time they just dropped it, every time they dropped it. Now it's not going to be like that. When you every 3 months or every 6 months, you tell them what you need and then.
Okay. So our role as a patient of low blood pressure, role is that you reduce the salt intake, low fat diet, 5 portions of fruit and veg every day, exercising 2.5 hours of exercise at least every week, and then so simple things that we can do. And don't stop your medicine without monitoring, please. If you don't be a no castle, anytime between keep monitoring. Thank you very much.